If you've ever wondered about how embryologists help guide some of the most important decisions in IVF, today's episode is for you. Welcome to the Egg Whisperer Show. I'm Dr. Amy, your Egg Whisperer. In this week's episode, what embryo development can tell us about IVF success. We're diving into fascinating research on embryo growth, genetic testing, implantation rates, and what today's fertility preservation trends tell us about the future of family building. My guest is Dr. Tricia Adams, a senior embryologist and laboratory manager at Ovation Fertility in Baton Rouge, Louisiana. Dr. Adams has spent her career studying reproductive biology, embryo development, cryopreservation, and fertility preservation. She's also the lead author on important research examining how embryo development stages may impact ploidy status and implantation outcomes. We'll discuss day 5 versus day 6 versus day 7 embryos, hatching versus hatched blastocysts, the growing demand for egg freezing, and what patients should know about the science happening behind the scenes in an IVF laboratory. And here's a question to consider as you listen. If two embryos look similar under the microscope, what hidden clues might help embryologists better understand their potential? Tricia, welcome to the Egg Whisperer Show.
Thank you for having me. I'm glad to be here.
You have a fascinating background that spans reproductive physiology, stem cell research, animal models, cryopreservation, and human embryology. What first sparked your interest in reproductive science, and how did that path eventually lead you into fertility labs?
So my interest in reproductive science really started with just the biology of development, how a single cell can carry the potential to become an entire organism. So as an undergraduate, I became involved in reproductive biology and embryo biotechnology research at LSU. And that opened the door to many animal models. And I gained skills such as oocyte handling, embryo culture, cryopreservation, and stem cell related work. It was sort of the combination between very precision science and then real world impact. I was working with cells, reproductive technologies in a very technical way. But then I moved to human embryology, and then that same science that was very technical before became directly connected to patients and families. So fertility laboratories allowed me to apply very technical skills that I had developed along the way, such as microscopy, embryo manipulation, culture systems, cryopreservation, very rigid quality control, but in a setting where these outcomes could impact someone's life. So, ART or assisted reproductive technology just uses these science techniques to help people build families. It's truly a wonderful field to be a part of.
Yeah, and I imagine that the folks that go to your lab, knowing that you're there, makes them feel really comfortable, knowing that there's someone that's so skilled, so smart, and clearly cares so much. And many patients never actually meet you. They don't actually meet the embryologist caring for their eggs and embryos. Give us a glimpse into what happens behind the laboratory doors and the role embryologists play throughout the IVF process.
Sure. So the embryology lab is one of the most important, but definitely least visible parts of the IVF process. The patients may never meet the embryologist. Some labs, the patients will speak with the lab team, and some they do not. But we're involved at almost every critical step. So, we identify and assess the eggs after the retrieval. We prepare the sperm, perform the insemination or ICSI. We monitor for fertilization. We culture these embryos for days at a time. We grade their development. We perform the embryo biopsy when genetic testing is planned. We vitrify these embryos, warm the embryos for transfer, all while maintaining cryo storage systems. So these embryologists are very hardworking, all behind the scenes, but they definitely care about the patients the whole way through. So behind the doors, the lab is highly controlled and very highly documented. Every single step involves witnessing, labeling, timing. We have to monitor all of our environmental aspects. What is the humidity and the temperature in the room when we're doing these procedures? So, of course, it's very intense quality control. But then also lots of communication with the clinical team. So these embryologists, they are, even though they're unseen, they are constantly making observations, technical decisions that help protect these eggs and embryos while giving them the best possible culture environment. So just know those embryologists, even though you might not know who they are, definitely rooting for the patient behind closed doors.
They are. And you
Yeah.
make the IVF doctors look good. So when patients say, thank you so much, I know exactly who I should be thanking. So I have to ask you a question. What music do you guys listen to in the lab?
Oh, it depends on who's working that day. And it's also the mood of the lab. Sometimes when it's a really busy day, they want something very upbeat, to
Uh-huh.
kind of keep it going. But it definitely depends on who's in charge that day.
Okay, I love that.
Yeah.
So let's talk about hatching versus hatched blastocysts and the research that you did. One of your studies was presented at ESHRE, examined this very thing. What inspired this research question, and what were you hoping to learn about embryo stage, ploidy status, and implantation potential?
So this really came about just from a very practical question in the lab, and one that we would have constantly when we were discussing with the clinical team about which embryo should we transfer, because maybe the grading was the same or the ploidy status was the same. So we just wanted to interpret, how are these embryos that have fully hatched out of the zona compared to the ones that are just hatching or just starting to hatch at the time of biopsy or vitrification. So these fully hatched blasts can be more fragile. They're no longer protected by the zona pellucida. So often people are very leery about transferring them because they could be very sticky. Some labs or clinicians have been just super cautious about selecting these embryos. However, but we wanted to look at whether that caution was actually supported by data from our laboratory. So we examined the embryo stage, hatching versus fully hatched, and whether it was associated with the ploidy status, and whether it also translated into a difference between implantation potential after the transfer of these euploid embryos.
And then what did you find out?
Well, we found that embryo stage appeared to have some relationship with ploidy distribution, but it did not significantly change the implantation rate. So as long as we transferred a euploid embryo, it didn't matter if it was already fully hatched or partially hatching, at least in our laboratory. The implantation rate was 40% for hatch blasts versus 50% with hatching, which seems like it should be a big difference. But with the numbers that we had, that difference was not statistically significant. We
Fantastic.
did, however, see a few differences in ploidy categories. And just of note, at this time, we were using, not just normal and abnormal or euploid and aneuploid. We were also looking at high mosaic and low mosaic. And not all labs use all four categories. Some it's 3 or just 2. But that's what we looked at. And the takeaway, there was abnormal and high mosaic rates did differ between the groups, while the euploid and low mosaic rates were completely the same. There was no difference between the group. So I guess the takeaway would be that the embryo selection just shouldn't rely on one visual feature alone. The stage matters, but it's only one part of a much larger picture.
Right. So someone's chicken is outside of the egg already. They don't have to worry that that chicken's not going to turn into a.
Yeah, I mean, it's got to come all the way out anyway at some point,
Right.
and so the big
Right.
concern is just, can you handle it delicately enough to get it to the uterus and let it implant?
So if you're a patient listening to this, how do you ask your clinician that question about in their lab, how does the stage impact the implantation rate? How can a patient advocate for themselves?
I think that just patient education is important. I think that there's also a lot of information out there. I know the patients that we have, they just want to know. They're trying to absorb so much information that I think they just need to ask, what are the rates in your lab? Because they're going to get lots of information from the public, from, say, social media or other things that they've read. But I find it's really important to understand this statistics within that facility themselves, because sometimes they are a little bit different than what is out in the public. So I think they just need to ask, what happens in your lab? What are the rates in your lab? Does that really matter if I get an embryo transferred here that is fully hatched or not?
Okay, so listen to
Mhm.
this. I have patients who I tell them to ask their lab that question,
Cool.
and then their doctor says it doesn't matter what the quality is, the implantation rate is the same no matter what.
Yeah.
What would you say to that? If you were the patient and your doctor said that to you, how would you try and advocate for yourself based on that answer?
I, of course, go back to numbers myself, and maybe everyone else doesn't do that. But I feel that the numbers don't lie. I want to see historically what has happened to know that. I mean, how do you know that that doesn't matter? And that's just myself. I want to know what has historically happened at this facility with these parameters.
Right. So I would say you just say, Dr. Amy calls that a load of BS.
Yeah. Yeah.
Probably your way of advocating yourself is
Yeah.
better.
Yeah.
Yeah. And then there's this perception that a day 5 embryo is always better than a day 6. And I hear that in my patients' voices when I say to them, oh, we have 4 day 6 beautiful blasts. And they're like, oh, none of them are day 5s. So
Yes.
based on the data you've seen, how should patients think about developmental timing, embryo quality, and genetic testing results when evaluating embryos, especially in cases where most of them are day 6?
So I have a few different things. I think patients should be very careful with the idea that day 5 embryos are always better. Day 5 development is definitely a favorable sign. It means that the embryo, reached milestones, as expected, but it's not the whole story. I mean, it goes back to the same as hatched versus partially hatched or fully hatched, is it's only one part of the picture. A day 6 euploid embryo can be an excellent embryo that absolutely leads to a successful pregnancy. I think another thing that has changed over time in our field is biopsy. Okay. Embryo biopsy has increased dramatically across all of our field. And sometimes people will wait to biopsy an embryo. So maybe the embryo is ready on day 5, meaning it meets its morphology key points where what it needs to meet on day 5. However, it's still a little small and maybe doesn't have enough cells that you want to biopsy. So a lot of places will hold that embryo a little bit longer to day 6 so that it is more expanded, has more cells, so that they can biopsy that embryo and it remains more viable for freezing and thawing. So there's a lot of misleading embryos that maybe actually were day 5 embryos, but that they were biopsied and frozen on day 6. So, I mean,
Exactly.
that's something that I found has become increasingly more common, which I think that's also how we led to day 7 culture.
Mhm.
Because of the same thing. We were just waiting a little bit longer for them
Mhm.
to be big enough to do what we
Mhm.
want to do.
And then have you ever gone to day 8?
I have not gone to day 8. It is a topic out there. I feel like that's pushing it a little bit. Personally, we track our day 7s, and our day 7s have absolutely led to positive pregnancies, but the rate is lower. It's funny that the timing of this conversation, because we've been talking about that the last 2 weeks about reevaluating our data, because this data came from 2021 and 22, and so now we're doing day 7. So we're actually pulling our data together right now to maybe submit an additional publication for next year, including day 7s.
Yeah. Yeah,
Yeah.
I only go to day 8, obviously, for my day 1 ICSI egg, so my IVNs.
Oh, yeah, that's different. Yep.
Obviously, that's a
Yep.
day 7 for that embryo,
Yeah.
but I've maybe gone to day 8 once where there's an embryo that hasn't arrested on day 7. I'm like, "Come on, you could
You
do it.
only have, though,
Come
the ones
on."
where you're treating the patient.
Right,
It's the only one that they have, and it's
right,
day 7, and it's still going, but it's not quite there. And, we
right.
haven't done it in our laboratory, but
Mhm.
it's definitely that's the conversation is, do you just treat the patient? Maybe it's the only one that they have, you
Right,
know?
right,
Yeah.
and that's exactly the scenario that I did that in.
Yeah.
Unfortunately, did not make it to day 8, but that's
But you
okay.
can at least, say that you tried everything,
Right.
you know?
Exactly, exactly, that's important. So before entering human embryology, your doctoral work focused on improving cryopreservation outcomes for equine oocytes,
Mhm.
so horse eggs.
Yeah,
What
horse eggs.
lessons horse eggs. So what lessons from that research, and I want to know how you got those eggs, but what lessons from that research continue to influence how you think about egg freezing and embryo preservation today?
So my doctoral work on cryopreserved equine oocytes, it really just reinforced how complex cryopreservation really is. So, of note, horse oocytes do not freeze well. Just problem has not been fully solved. But freezing eggs or embryos, it's not just about cooling and warming cells. It's about protecting very delicate cellular structures. You need to limit ice crystal formation during the process so that it doesn't shear any of these cellular structures. You're managing osmotic stress and then understanding how the cell responds after warming. So the research, it still influences how I think about fertility preservation, because they're especially very, very sensitive cells, and every detail matters whenever you're handling or doing cryopreservation with oocytes. The protocol, the timing, the cryoprotectant exposure, temperature control throughout the process, the handling technique, and then post-warming assessment. the most important thing that it has taught me is that survival of the oocyte is only one outcome. We also have to think about developmental competence, whether that cell, even though it survived cryopreservation and warming, can it continue to function normally after it's been cryopreserved?
Yeah. And I wish we could perfect every single stage in that process because it's so hard. You have these patients that come in at 45 and they froze their eggs at 32 and none
Yep.
of them develop into a strong embryo. And it's just so heartbreaking because you know that they did the work, they were intentional, and it's just something that I wish we were better at.
I
But we're
mean,
getting better.
I was just, I don't even remember the cell is so large, the oocyte is so large. There's a lot of cryoprotective stuff to get in there, and the cellular structure is very delicate, and you have microtubules and all of these small, small, fragile things that are impacted.
Yeah. So now tell me, how do you get an egg from a horse?
So, fun fact that horses do not actually respond very well to exogenous hormone stimulation. So, it's not like in humans where you're going to give them hormones, you're going to track the cycle, and then you're going to get as many eggs as you can. They just do not respond. So, you may get one egg, you may get 7 eggs, and you don't really know how many you're going to get. And that's how the eggs are collected in the US. So if you want to do research or do things to get more oocytes so that you can have higher numbers to do your research, then you have to go outside of the US.
Wow. Wow. That's impressive. So recent research has shown that elective egg freezing cases have increased dramatically. And, I've seen that as well in my practice.
Right.
From your perspective, what factors are driving this growth? And what conversations are women having today that may be less common than a decade ago?
I think that the growth in elective egg freezing just really reflects a major shift in how women are thinking about their reproductive planning. More women are delaying childbearing because of education or career goals, financial considerations. Sometimes it's just personal relationships. Maybe there's medical factors, or they're just simply not ready to have a child. But at the same time, the awareness of fertility preservation has increased dramatically. I mean, just a decade ago, many women did not know that egg freezing was even an option, or they thought that it was only in the context of maybe doing it before cancer treatment. So today, women are asking much more proactive questions. What does my fertility look like right now? How much time do I have? Or should I preserve options before I need them? So I think that this recent data is showing a nearly fourfold increase of elective egg freezing. It just reflects a broader cultural shift. I mean, we even have, I'm a lab director for a lab in Vermont as well, and they have a partnership with an Olympic medalist who is going to help them to promote fertility preservation because she
Yeah.
didn't know that it was an option. And now she does, and she wants to make it known to other people that this is an option and that women can have control over their fertility.
Do you think we're ever going to get to a point where egg freezing is going to be free for everybody just to help preserve our society?
Maybe. I think that there's been an increase, just say, in fertility coverage, even in the last 5 years. I think we're not there yet. I think that we have to get to a point of getting fertility coverage out there, period. And then egg preservation is going to lag behind, I think, until it's seen as a necessity,
Mhm.
unfortunately. But one thing is, I wish that more people understood that egg freezing is an opportunity, but not necessarily a guarantee.
Right.
It can be a very powerful tool for family planning, but the success depends on so many things.
Right. Right. It's not a guarantee for
Yeah.
sure. And for those who are considering egg freezing, what do you wish that they understood about the process, timing, expectations, and the role it can play in future family planning?
It can be a very powerful tool, but the success depends on your age at freezing, ovarian reserve, the number of mature eggs that you get, and then also the oocyte survival after warming, fertilization, embryo development, embryo genetics. So I think in the most is that timing matters. In general, freezing at a younger age, it might provide you better quality eggs, but then the decision is very personal and it depends on medical and emotional and financial factors. Maybe when you're younger, you don't have the financial means to do it. But I also think that patients should understand that one cycle may not give them the number of eggs that they hoped for, and that some patients may consider more than one cycle depending on their goals. Because we've had patients come through and they think this is it and this is what's going to be, this is the savior. and then they get a handful of eggs, and they have a larger expectation for their family goals, and that you may have to go through more than one time.
Yeah. Yeah. What about sperm freezing? Do you think that's going to become more popular?
I do, actually. We've actually had several conversations here lately within our clinic just about sperm cryopreservation. A lot of times it's only because someone is going to be out of town, or maybe they have poor parameters, and so they want to have some cryo backup. But it is becoming a lot more common. We have had fertility preservation, of course, for reasons that people think of cancer treatment, prior to cancer treatment, things like that. But it is definitely becoming a lot more popular here lately than it has been in the past.
As someone deeply involved in both lab operations and fertility research, what developments in embryology, embryo assessment, or fertility preservation are you most excited about in the coming years?
I am most excited about the developments that are going to help us evaluate embryos more accurately while keeping the process very safe and efficient. Embryo assessment has become much more sophisticated, and I think that in the future, it's going to involve combining morphology, developmental timing, genetic testing, AI, and other non-invasive assessment tools, and put that along with laboratory like quality metrics, but in a more integrated way. Sort of forming an embryo score, a metric that pulls all of this information together so that then you can sort of rank the embryos in higher expectation of resulting in a pregnancy. I'm also excited about just continuous improvements in cryopreservation and fertility preservation. Egg freezing has already changed the conversation around reproductive autonomy. As as the technology continues to improve, I think that we will continue refining how we counsel patients and how we preserve reproductive potential, and then also how we select embryos in a way that is evidence-based and individualized and patient-centered.
I could cry. Yes. To all of that. Um,
Yes.
I love this interview. Okay. So, for listeners who would like to learn more about your work, Ovation Fertility, or the research we've discussed today, where can they find you and connect with your team?
So you can go to the Ovation Fertility website, but then I am also connected to Fertility Answers, which is our partner clinic here in Baton Rouge and also in Lafayette. We have two locations. So the Fertility Answers website has not only myself, but all of our embryology team on there with our bios and our education backgrounds. And you can learn all about our entire team there.
That's great. Well, Tricia, thank you so much for joining me today and for sharing your expertise. And thank you to you and your colleagues, Mariah Markle and Chelsea Leisinger, for your ongoing commitment to advancing fertility research and improving outcomes for patients. To our listeners, you'll find links to everything we discussed today in the show notes. If you enjoyed this episode, be sure to subscribe to the Egg Whisperers show on YouTube and Spotify so you never miss an episode. And wherever you are in your fertility journey, remember this: every embryo, every cycle, and every step forward teaches us something valuable. Keep believing in your possibilities, keep moving forward, and always keep shining your light. Until next time, keep on sparkling.